Hi, my lovely. It's Amy again. And I just wanted to, my last video, I kind of shared what you could do in a chair. So I thought I would do this video on actually sitting in a chair. So again, we're talking about fascia and how that changes and with movement and how it covers your entire body. Fascia is the stuff that covers every organ, covers every muscle cell, and then it covers every muscle. It's eventually what ends up being your tendons is this fascia. It also covers every bone in your body. And then there's bigger pieces of fascia that kind of cover all your organs, kind of keeps you like sucked in a little bit. And then it also is kind of it's the stuff that kind of contains you. It's that connective tissue, and it's very mobile. It also is very sticky, so sometimes it can get like if you pull it apart underneath a microscope, it looks kind of like cotton candy, and it can be a little velcro-y. So you want it to be smooth and to slide nicely. And when you find the right tension to help it let go, then it flows and you feel much better. And with free movement in your body, you're healthier and you feel better. So that's one of the reasons, again, just to kind of remind you, since we are doing movement, things that can kind of come out as you're doing it are sometimes memories, sometimes emotions, sometimes you can have these feelings or have these little flashes of something that seems to kind of come up. Just notice them and appreciate them for what they are, and remember that your body remembers everything. So as you're letting go of different tension in your fascia, it's helping you release all these different things that your body's experienced over the years. So kind of let you know. So like this is just your normal table chair has this one is actually like a stool height, and it's got a place for my feet. So this one fits me pretty well. I like to sit in it, but it doesn't necessarily have to fit you to get what I'm trying to get across. So basically, it's just a firm chair, so that I can kind of feel like what is asymmetrical. Again, we're going to release things asymmetrically. So everything you do on one side of the body, you wouldn't necessarily do on the other, because that's not how your body works. It's not symmetrical. And so I'm already noticing that I want to kind of shift to this side. So I'm going to let my body do that. I might give it a little support by holding on over here and seeing where I really want to go. I might hold on over here and just kind of feel into what, not really sure what muscle right now wants to be released. I think it's part of my hamstring. And I'm just noticing, and now I'm putting pressure with my arm. My body is twisting. So it feels like I might be working a little bit more on my low back, but I'm not entirely sure because I didn't really set an intention. But it feels very important that I have this pressure on this leg. And I'm also noticing that I'm keeping a lot of pressure going this way as my arm is rotating. And I'm just noticing how I feel tension over here kind of being released up into these lower ribs. And it feels like my arm is relaxing a little bit more, and I'm letting go. And now I'm going to sit and kind of notice what shifted, what happened. I do feel like there's something, my hamstring, my glute area, that seems to have changed. I'm feeling a lot looser on the outside of my leg. So if you were to cut this leg in half here, The inside still feels tense compared to the outside. And then that, if you follow that line up even into my hip, the outside of my hip feels more tense than the inside of my hip. Sorry, the other way around. Outside of my hip feels less tense than the inside of my hip. So if I'm just looking at this inner part of my hip right now, seeing what it wants to do, I'm noticing that like I now kind of want to roll this way. By doing that, I'm actually putting some tension, probably with the corner of this chair, onto my hamstring a little bit. And that almost feels like a trigger point kind of release. But it's like I can feel my muscles are just kind of doing this automatically. Like it's like, if you do this, this is going to feel better. And I think this is more of the intention that, again, didn't put it on a specific thing other than to just see what my body would do. It started to get to a point where it's a little tender, so I'm just going to relax, and then move up a little bit and see if there was something else that wants to kind of release in that same way, because it didn't feel like it was quite done. It just got a little pokey, and I don't really like to be in pain, so and the purpose of this is to kind of stay more in a pain-free, helpful zone versus like really pushing something into that trigger point, that really like painful part. So kind of again to check where I'm at, feeling this leg, the tension on my inner leg has kind of changed. Now it shifted again. Now it feels like it's more on the outside, but not quite. So maybe it's kind of like this middle third that feels tight now. And I feel that from like my knee all the way up to like if you were to follow that like all the way up into like right here, like that middle third section. So it's not like it just stops at my hamstring or stops at my glute. It kind of like this whole area, like this whole lower part kind of. And I'm just noticing, so now I feel like my intention for like whatever movement's happening is probably like that inner third, and now it feels like, so I'm straightening my knee. I don't know if you can tell because I'm kind of out of the camera frame here, but it feels like I need to straighten. I'm also turning my leg a little bit, and then I'm flexing my toes towards me, so I'm pulling my toes back up to me, and I'm just like feeling things. I'm just kind of letting my body do whatever it does. I'm not thinking about it. Now my leg is actually pointing. My knee is slightly bent, but I'm back into like really pointing through my toe into the point where like I'm feeling kind of a cramp go through my big toe, but it's not uncomfortable and it's not staying in the same spot. It's kind of like not tingling, because it's definitely like that cramp feeling, but it's kind of like shifting up my toe there, and like kind of going from like it seemed to start a little bit more in my heel, and then as it kind of started to go up through this line, and I'm noticing as it kind of keeps doing this, as I shift my leg is now kind of rolling out, and again my foot is still pointed, and I'm noticing as I keep it pointed that like through my big toe it's still feeling very cramped, but I'm still allowing it to do all this, and because it's not very uncomfortable. It's just kind of like I feel the cramp, but it's not like. And now my leg is slowly kind of coming back, so I'm bending my knee, and now my foot's over here, and it feels like I need to be more in this position. But now this feels, yeah. So this feels more relaxed now, and it feels like whatever I was just doing kind of stopped. So and my foot feels a lot more relaxed. And so now, like, if I sit back in this position where I was at the beginning, and kind of feel into like what feels like tense, one side of my body versus the other, on the leg, it's feeling, I would still say like that middle third is probably still the most tense, but it's probably a little bit more off to the side of like the inner side, the inner part of my leg side. So every time it kind of seems to shift just a little bit when I come back to like baseline, if you want to say that. But your baseline is going to be different every day. You're going to work on different things every day because the fascia changes every day because you change every day. So this is just one other way to kind of feel into it. I'm feeling like I now need to stretch through here a little bit because I just did all that work on kind of like the lower part of my leg, and now this upper part that's still very connected feels like it needs a little attention. I have something over here I can lean on and put my weight on. I can also grab onto here, but that it feels like I need to like support myself right here. So I'm gonna do that and see what happens. And that feels like that might have been about it. And that feels pretty good. So again, if you'd like to see some more videos, please check me out at Somato Enlightenment on Instagram, Facebook, and YouTube. And you can also check out my website, which is somatoenlightenment.com. And look forward to seeing you over there. And if you like anything that I've said, please share. And I'll talk to you guys again soon.